Uh, Over 50% of Arkansas counties are considered maternity care deserts. Can you clarify how HHS is going to allocate those funds and how the department will continue?
I can't specifically answer your question. I know that we have a $767 million block grant from HRSA for maternal health, and I imagine the reaction that I get from the farm community is very, very positive, and I'm very grateful for that. And I know that, for most farmers, they're losing money 7 out of 10 years, and we want to make sure to keep the farm economy intact. We know.
Thank you.
Thank you, Senator Merkley.
Senator Merkley, thank you. Senator Boozman.
Thank you. Thank you, Mr. Chairman. Thank you, Secretary, for being here and spending so much time. I know this has been a long day. As you know, Arkansas is home to the FDA's National Center for Toxicology Research in Jefferson, Arkansas. During a recent visit, I met with the NCTR scientists and discussed their unique regulatory science mission, as well as concerns about a potential transfer of the center to CDC. We discussed this earlier in the year. You and your staff have been very helpful. I've expressed my opposition to changes that would weaken its distinct and essential capabilities. What I would like is that as the conversation goes forward, that certainly if you have any updates or any changes that are about to occur, that we would be allowed to be part of that discussion.
That is a very important program to us, and I expect to continue to support it, and we'll let you know if anything changes.
Very good. Thank you very much. Over 50% of Arkansas counties are considered maternity care deserts, meaning expectant mothers lack access to birthing facilities or obstetric providers. Data from the Maternal Mortality Review Committees, supported through the CDC's Safe Motherhood Initiative, shows that women in these areas receive less prenatal care and face higher rates of preterm birth. Earlier this year, I worked with Senator Bennett to pass the Preemie Reauthorization Act to strengthen federal efforts to reduce preterm births that have complications. Can you clarify how HHS is going to allocate those funds and how the department will continue supporting state-led maternal mortality review committees to ensure care is informed by local data and improves outcome for mothers and infants? This is really a critical problem in Arkansas. 53% of our counties in America lost population last census, and as a result, this is an area that's really been affected.
I can't specifically answer your question. I know that we have a...
What you just heard is a subtle but important shift from a highly specific, data-driven question to a noticeably vague answer. The senator laid out a clear concern: funding allocation, accountability, and how local data actually improves maternal outcomes. But the response? A general reference to a large block grant, followed by uncertainty. That gap matters. When billions are being discussed, I imagine isn't reassurance. It's a signal that the chain of accountability may not be as tight as it should be. So the real question becomes, if leadership can't clearly trace how these funds are used, who actually can?
$767 million block grant from HRSA for maternal health, and I imagine it's funded through that, but I don't know. But I will. I'm happy to work with you on that, Senator. It's an important issue to us, and I'm happy to work with your office.
Yeah, if you could get them to look at the state-led maternal mortality review committees, I would appreciate it very, very much. One final thing. Our agriculture sector now is in such a difficult situation. If you're growing something out of the ground, you're losing a lot of money. And because of that, we're doing everything we can to help them. I agree with you. The department's recent initiative encouraging medical schools to implement comprehensive nutrition education and training. The Walton School of Medicine is a good example of that in Arkansas. They're taking the lead. So I very much believe that nutrition is so very important. At the same time, growers in my state and across the country face real challenges. So can you ensure the American growers that the goals of making America healthy do not unintentionally create barriers to crop protection tools that are already undergoing a rigorous science-based review process at EPA? Will you commit
Senator,
to working with our farmers?
Before we issued the MAHA report, we had over 100 meetings with farmers and all the leading farm organizations in this country. I met with them again last week, representatives of all the major farm organizations, and we collaborate with them very well. They've been very supportive of the MAHA agenda, and and I expect that to continue. And everywhere I go in the country, the reaction that I get from the farm community is very, very positive, and I'm very grateful for that. And I know that, for most farmers, they're losing money 7 out of 10 years, and we want to make sure to keep the farm economy intact. We know that MAHA is dependent on our food production, and we can't afford to lose any more farmers in this country.
This exchange may sound procedural on the surface, but it reveals something deeper about how policy, funding, and accountability intersect, and sometimes fail to align. The senator came in with a focused agenda: protect a critical research center, address a worsening maternal health crisis, and ensure that agricultural policy doesn't unintentionally harm already struggling farmers. These are not abstract concerns. They're grounded in real outcomes affecting real communities. But what stands out most is the contrast between specificity and generality. On one side, you have detailed statistics. Over 50% of counties lacking maternity care, higher risks for mothers and infants, and legislative efforts already underway to address these gaps. On the other side, when pressed for clarity on funding allocation, arguably the mechanism that turns policy into action, the response becomes less precise. A $767 million block grant is mentioned, but without a clear breakdown, without a defined pathway, and without immediate accountability. That's not a minor detail. That's the core of governance. Because when funding lacks transparency, outcomes become harder to measure. And when outcomes are unclear, it becomes easier for systemic problems to persist. In this case, the issue is maternal health, where delays or inefficiencies don't just affect budgets, they affect lives. Then the conversation shifts to agriculture, and again, you see a similar pattern. The concern is forward-looking. Could well-intentioned health initiatives create unintended barriers for farmers? It's a fair and necessary question, especially in an economy where, as stated, many farmers are already losing money most years. The response emphasizes collaboration, meetings, and positive feedback, but stops short of offering concrete safeguards or policy specifics. And that's the recurring theme here: reassurance without detail. Now, to be fair, not every hearing produces immediate, fully formed answers. But moments like this are revealing because they highlight where clarity exists and where it doesn't. The senator is clearly pushing for precision, for inclusion in decision-making, and for protections that are not just promised but defined. The responses, while cooperative in tone, rely heavily on future follow-ups and general commitments. So what should viewers take away from this? First, that oversight matters. These hearings aren't just formalities. They're one of the few places where public officials are directly pressed on how decisions are made and how money is spent. Second, that gaps in answers are not neutral. When a direct question leads to an indirect response, it tells you where the pressure points are. And finally, that policy is only as strong as its implementation. You can pass legislation, allocate funding, and hold meetings, but if the execution isn't clear, measurable, and accountable, the impact will always fall short. So the next time you hear about billion-dollar programs or nationwide initiatives, ask yourself, who is tracking the results? Who is responsible when things don't improve? And are the answers as clear as the promises? If you found this breakdown helpful, drop your thoughts in the comments. What stood out to you in this exchange? Don't forget to like, share, and subscribe for more sharp political analysis that cuts through the noise.